what they did, they have your typical clinical guidelines and protocols for transportation. But what Kaiser Permanente did was they invested in very detailed qualitative research, something that I think is not sufficiently developed in most academic institutions, not sufficiently anyway. So they did in-depth qualitative research and had both the patients and the health workers, the transport, the paramedics, to co-design the process, but with emotional mapping. And so what happened was that they went and tried to figure out, as they moved through the protocol, the standard protocol, where were the pain points, the emotional pain points, not just on the patient, but on the health worker themselves. We forget that the health workers are people too. But by doing so, they were able to identify where the pain points were and offer an intervention like deep, briefly, step back, like what we did just now, and actually then integrated that into their clinical protocol. It was actually, now it's part of their protocol. And so as a result of this co-design, which we've been talking about, co-designing and co-creating, of course the patient felt the human connection which they were craving and less anxiety. And for the staff, they gained a sense of autonomy, because before they felt crushed, sense of autonomy, empowerment, and purpose. They felt that they had a purpose in saving lives. So this is an example where emotional content needs to be really explicitly designed. And so two things, I think this kind of qualitative research need to be much more part of the curriculum. It's not just doing some quick interviews. This is a very sophisticated methodology that needs to be brought forward, but also a much deeper understanding and appreciation of the emotional impact. And I think all of you who are practitioners really understand that, but we need to go beyond ad hocism. How can we make it much more of a mainstream? That's my plea to those who are really in education. That's at the micro level. So one other thing I wanted to leave with you is what I learned from the wise people at the OECD, the Organization for Economic Cooperation and Development. It's a bit of a mouthful. This is really a think tank for the high-income countries. And so people who are in development, like the World Bank colleagues, would poop, oh, well, it's only for the high income, it's the rich club, not interested. Well, actually, what is going on with the OECD countries have a lot that could be shared. And we really are doing disservice, I mean the World Bank, by dissociating the high income with the lower income. In a way, we're ghettoizing the analysis of the lower income countries. But what I appreciated with OECD is their mission is to develop better policies for better lives. Not better, more efficient economy, not for greater economic growth, but better lives. And they went on, better lives, lives lived well. Not just long, but lives lived well. But the challenge was, what do you mean? It's not just a generic happiness factor. Based on behavioral sciences, what is of value to the human beings? So what I've got up there, and they have a nice Better Life Index, Wellness Index website, that is still work in progress. But they're trying to really understand what is well-being in the context of at the national level. And they do a lot of detailed questionnaires with Gallup to test out what is valuable. So a couple of examples I give. Social connectedness is an extremely important value. So they're testing a lot of ways in measuring social connectedness. How many people in your lives can you rely on if you're in debt, if you're sick? They try to do some metrics around that in terms of social connectedness, about your jobs. Are you happy in your jobs? Japan, my country, my other country, is extremely high on safety, extremely high on job security, extremely high on education, but we are miserable at our jobs. Our work satisfaction, 70% said they are not satisfied. So we have Japanese who have all these wonderful benefits, social benefits, and yet, look, we're miserable. And we have suicide rates, very high suicide rates. So how do you bring these into the equation? In fact, organizations like OECD is trying to start to develop a measure, and they have measurements for their 35 countries plus additional 6 or so non-OECD countries. So I think this is an important step forward. And that is why I wanted to make this plea that we need to move towards a greater awareness of the emotional content and the implicit human experiences, which is full of generosity but also full of biases. We have to be very honest with ourselves. We need deeper reflections by all the citizens. Citizens, not just the patients on whom we do things, but all the healthcare providers, the governments, they're all citizens on the moral and ethical implications of our choices. And I think, including economics, but I think in medical education, I don't think we do enough on thinking deeply about the moral and ethical implications of what we do. And that needs to be expanded. And what we need to do is to design systems that do generate rules and create boundaries, but they have to emerge and evolve organically. This is what we call the emergent aspects. And how can we do that and create a system that organically then generates and evolves with the needs and the changing values and needs of the population? But evolving to what end, you may ask? And here I take my cue from my own culture of Japan. And we have a couple of words that, to me, represent what is the purpose in life. And we have a word called ikigai. Ikigai literally means purpose in life, feeling of, oh, get up in the morning, someone said, oh, because I see my granddaughters, or I see this beautiful, the love of my life, or my family. Everyone has to have that spark of joy. Some of you know about Marie Kondo and the cleaning thing, but that's the same principle. Does it give you a spark of joy? We cannot take that equation out. And Paul Samuelson just made it into an efficient allocation problem. And others on social accountability are just making it into equal distribution or equitable distribution. Where is the joy? Where is the human psychology on that? So ikigai is one purpose in life. And then the other part is connecting individual lives through very thick social network connections, lifelines. And in Japanese, there's a word called kizuna. Kizuna is like it's a lifeline. It literally means lifeline. And we talk about kizuna with our families, of course, but kizuna with the sacred tree, the kizuna with the rock, the foundation, kizuna with that volcano, kizuna with Mount Fuji, which is a sacred mountain for us. So it is the feeling of connectedness, not just socially, but also in terms of our environment, not just with humans, but with other animals and with other living creatures. So these are the two, for me, that represent a goal. If we talk about social accountability, of course we have to be socially accountable. But can we bring much more mindfulness in the way we think about social accountability so that it drives us towards a sense of ikigai and really develop that thick social connectedness of kizuna? And in this last slide, I wanted to share a story of what has happened to Japan after that terrible tsunami and earthquake in March 11th, 2011. As many of you know, that was an absolutely disastrous event. Some 20,000 people lost their lives with not so much the earthquake. Earthquake didn't hurt many people, but the tsunami afterwards really destroyed and took away so many lives. And I still recall on the TV, we were anxiously waiting after the tsunami had receded. There was an emergency hospital getting ready for those who had been hurt. You know, all the doctors, nurses, the paramedics were ready to go and save the people. And there's 30 minutes, an hour, 4 hours, 24 hours, dead silence. I remember sorry, it's just very emotional because I remember the look on the faces of the doctors and nurses when they realized there wasn't a single survivor. Everybody who was swept away, there wasn't a single survivor. There was no patient whatsoever in any of these emergency hospitals. Later on for the chronic cases and so forth, but at that moment, it really struck us. It was an incredibly traumatic experience for us that could happen to us. But what happened afterwards, and of course you had the government, the national government was too busy dealing with the nuclear crisis, and so they couldn't get to those places that needed help. What happened was there was this outpouring of volunteers from all over Japan. Thanks to SMS, they used the Google map to find out where the roads were passable. They exchanged information. They said, who needs diapers? I've got diapers, but this place has too many diapers. Can you send it to the other way? There was a spontaneous, emergent network of kizuna, of people helping each other, but also using technology, their know-how, to really try to help these communities. And it was a beautiful, beautiful experience. And these groups have now grown, and unfortunately Japan has regular crises every year of this kind. And what has happened is that we had recently in South, in Kyushu, this disaster, mudslides and typhoon. And so people from the Northeast who had received help, they went in their turn and volunteered. So there's been a lot of great exchanges. What was the conclusion of that year? At the end of that year, every year in Japan, our chief monk in Kyoto asks and decides on the character of the year. What is the characteristic that defines the year? So there were a lot of discussions that people suggested. Was it crisis? It was a disaster? It was a catastrophe? It was a trauma? But no, the word that people wanted most was the character for kizuna, because that disaster re-established the sense of kizuna, of purpose, of connectedness amongst many of the youth who felt very disconnected, felt reconnected. And so the picture on the left is our monk from Kiyomizu-dera who wrote the word kizuna and said, this is the word, this is the national unity moment. We all cried. But what was even more moving also for us was that we, in Japanese, got help from countries like Indonesia and Bangladesh. Small contributions, and also people from Aceh. Remember, they had that Boxer Day disaster, tsunami, more than the decade before this time. And they sent this message of encouragement. So the picture on the left is also kizuna by the students from the Aceh University. And they're sending their words of encouragement and connectedness. And that, I thought, is the lesson, how a crisis, a trauma, can turn us back into being more human again and sharing our sense of connectedness. So it seemed that kizuna is a perfect Japanese word to describe the network toward unity for health. Thank you.